Hello, everyone. Dedicated to aging healthily and wisely. Imagine experiencing confusing and frightening symptoms, memory loss, severe fatigue, balance problems, numbness, symptoms that might make you or your doctor fear the worst, like dementia, heart failure, or even neurological diseases. But what if these alarming signs weren't pointing to an irreversible condition? What if they were actually a lie? A mask for something much simpler and, crucially, treatable. Today, we're exposing a common vitamin deficiency, particularly prevalent in seniors, that can tragically mimic some of the most feared fatal diseases. Understanding this could be life-changing. Stay with us to uncover this great mimic and protect yourself or your loved ones. Why are these mimicking symptoms so often missed or misdiagnosed in the 50-plus population? Firstly, many symptoms of this deficiency, like fatigue, memory lapses, or unsteadiness, overlap significantly with what's often dismissed as normal aging. Doctors and patients alike might attribute these issues solely to getting older. Secondly, the onset can be very gradual, creeping up over months or even years, making it harder to pinpoint a specific cause. Thirdly, seniors often have multiple chronic conditions simultaneously, making it complex to disentangle which symptom belongs to which condition. This complexity can unfortunately lead to delays in diagnosing the underlying and often treatable vitamin deficiency, allowing potentially reversible damage to progress. The great mimic we're talking about today is vitamin B12 deficiency. Vitamin B12, also known as cobalamin, is absolutely essential for numerous critical bodily functions. It's vital for the production of red blood cells, which carry oxygen throughout your body. It's crucial for the proper functioning and maintenance of your nerve cells and the myelin sheath that protects them. It also plays a key role in DNA synthesis, because it impacts such fundamental systems: blood, nerves, and DNA. A deficiency can manifest in a bewildering array of symptoms affecting nearly every part of the body, easily mistaken for other serious conditions. This is where B12 deficiency can be truly terrifying. Because B12 is essential for nerve health, a lack of it can cause symptoms that closely resemble serious neurological disorders. These include memory loss, confusion, difficulty concentrating, mimicking dementia or Alzheimer's, numbness, tingling, or burning sensations in the hands and feet, peripheral neuropathy, mimicking diabetes or MS, balance problems, unsteadiness, and difficulty walking, ataxia, mimicking Parkinson's or stroke, muscle weakness, and even mood changes like depression, irritability, or psychosis. Tragically, If the deficiency isn't caught early, some neurological damage can become permanent, highlighting the urgency of diagnosis. Beyond the brain and nerves, B12 deficiency severely impacts red blood cell production. This leads to a type of anemia called megaloblastic anemia, where red blood cells are larger than normal and fewer in number. This reduced oxygen-carrying capacity causes symptoms often mistaken for heart problems or other serious illnesses. Profound fatigue and weakness, mimicking heart failure or chronic fatigue syndrome. Shortness of breath, even with minimal exertion. Pale skin, dizziness, and sometimes a rapid heartbeat as the heart tries to compensate. Someone might undergo extensive cardiac testing, only to find the root cause was a simple vitamin deficiency. Why does B12 deficiency become so much more common as we get older? Several factors contribute. Firstly, stomach acid production tends to decrease with age. Stomach acid is crucial for separating B12 from the protein it's attached to in food, the first step in absorption. Secondly, the use of certain common medications, particularly metformin, for diabetes, and proton pump inhibitors or H2 blockers for acid reflux, heartburn, can interfere with B12 absorption over the long term. Thirdly, dietary changes, perhaps reduced meat intake, or simply poorer appetite, can lower B12 consumption. Lastly, an autoimmune condition called pernicious anemia, where the body attacks the cells needed for B12 absorption, becomes more prevalent with age. If you're experiencing any of the symptoms we've discussed, especially neurological ones, it's crucial to talk to your doctor and specifically ask about vitamin B12 testing. A simple blood test can measure your B12 levels. Sometimes, doctors might also test for methylmalonic acid, MMA, and homocysteine levels, which can be more sensitive indicators of a functional B12 deficiency, even if blood levels look borderline. The great news is the treatment is usually straightforward. Depending on the cause and severity, it might involve high-dose oral B12 supplements, sublingual under-the-tongue tablets, or B12 injections, especially if absorption is the main issue. Dietary sources include meat, fish, poultry, eggs, and dairy products, as well as fortified cereals. Don't let the great mimic fool you or your loved ones. Vitamin B12 deficiency is common in seniors, and its symptoms can be devastating if misdiagnosed or ignored. Be aware of the wide range of signs, from brain fog to balance issues to severe fatigue. If you have concerning symptoms, advocate for yourself and ask your doctor about B12 testing. Early diagnosis and treatment can prevent irreversible damage and dramatically improve quality of life. Have you or someone you know experienced B12 deficiency? Share your story respectfully in the comments. If this video provided crucial insights, please give it a thumbs up, share it far and wide, and subscribe for more essential health information for thriving after 50. Stay informed, stay healthy,